Hello, welcome back one more time on my YouTube channel Dr.Nilesh Advice. Today's topic is a good topic in that sense that the problem is very common. The topic is cough in the children. खांसी, खांसी, बच्चा खांस रहा, coughing. So this issue almost all the children, all the parents, all the adults has faced, that there is a coughing at certain given point of the time. You take some medication or maybe you just do some little gargling, your cough will start getting better. So I am not going to discuss today about the medications of the cough. Today I am going to discuss just informations about the cough, what is cough, why we cough, and is there any way that we can prevent the coughing. We can take any medications, but we will not discuss about the medications here, but is medicines are useful for the cough, and when to go to the doctor if you have cough. So what are the indications that you should go to the hospital if you have cough. So those things we will discuss today in this video. So first let's do one thing, is the what is cough. So cough is basically nothing but it is just a protective reflex of the body. So anything which is irritating our airway, like our airway or the respiratory system, starts from the nose. So from the nose, then you have throat, then you have windpipe or the trachea, and then you have lung. There is any irritation in this respiratory tract, you will have the cough. Like suppose if there is a pungent smell, like if you have smelled something very strong, you will cough because there is an irritation of the nose. If you have ate very spicy food, at that time you will cough because that will irritate your throat. If you are in the desert and if there is a sandstorm, you will cough because that sand will go to your nose or the airway and you will have the coughing. If you have allergies and if you will go to the park and there are pollens, you will cough because that pollens irritates your nose and the throat. If you have pneumonia, that is an infection, bacterial infection, then also you will cough. And even if you have lot of wax in your ears, then also you will cough. So basically the cough is a one kind of the protection. So this reflex is protecting your lungs by the any objects. So the body has various reflexes which help to protect our deeper organs. So lungs is our vital organs. So anything which is causing the irritation starting from the nose to the respiratory tract, body is not allowing them to reach up to the lungs. So that's why the body will cough and try to remove that object. It can be the irritation of the dust, it can be the irritation of the some food particles, it can be the irritation of the viral infection, it can be the irritation of the bacterial infection, but body wants to remove that out. That's why we cough. So the cough is a protective reflex, and that protects our lung from the various objects, various infections, so that they doesn't go to the lungs and cause the severe infection. The heart and the lung, two are the important vital organs which both are getting controlled by the brain. But the brain is concealed in a scalp. There is a bony area. Nothing can reach directly to the brain. Correct. So the brain is protected well. But the lungs and the hearts are direct contact with the environment. So whatever affects the respiratory system, ultimately it will affect the heart also, because lungs provides the oxygenated blood to the heart and heart has to pump. Okay. So if the lung is not doing their proper work, so they are not giving the good oxygenated blood to the heart, so heart has to work more, because ultimately heart has to provide the blood to the body. So if he is not getting the enough oxygenated blood, so he will work more to provide the oxygen to the whole body. So lung affected, heart affected, lung affected, both will go into the synchrony. Okay. So the cough is a protective reflex. So first of all, that concept should be clear, that why we are coughing because of our protection. We are not coughing because something else. Okay. Now then, if it is a protection reflex, then why we want to suppress it? If this is a protection, then why we want to suppress it? Right, thought process is correct. So many times I am informing this to the parents also, that if the child is coughing, but if it is not disturbing much, in a day he coughs 2 or 3 times, if he doesn't have a fever, he is not getting tired, he doesn't have the vomiting, he is feeding well, he is eating well, urine is fine, stool is okay, then I don't think that cough has a relevant importance. But yeah, if the cough is prolonged, it's coming very frequently, high grade fever is also there, child is visibly getting dull, he is getting sick, yes, then evaluation by doctor is important. Let him evaluate that what kind of cough it is. It is related to with just the running nose, it is related to the throat infection, is it related to the pneumonia, is it related to the bronchitis, or is it asthma? It can be anything, the cough can be anything, but on an average for any cough to take the medication, many times I don't advise also. But yeah, if the parent come and if they are more concerned, obviously we have to give some medication that relieves temporarily the cough, and that will relieve the parents' anxiety also. So the per se, the cough is a very good protective reflex which protects our lungs. Medication, many times it is not recommended. I will give you one example, like suppose you have the throat infection, viral infection of the throat. So your area, the throat area will become very thick, it becomes swollen. So that's why that is the irritation. So body will cough. So what will you do? In that case, you do the warm water gargling. So with the warm water gargling, the swollen throat will become suppressed, your cough will be gone. Like suppose you have a lot of nasal secretions, those secretions goes to the throat and you will cough. So you do the nasal spray, you do the steam inhalation, that irritation gone, so your cough is gone. Okay. But many times there is an infection in the lungs known as pneumonia, then there will be the good cough, persistent cough, and there will be the high fever also. Yes, that requires the medications, because then the baby also get tired, the baby will get sick, will have the fever, feeding will be going down. Yes, this is the indication, then yes, definitely some medication for the cough required. Very smaller babies sometimes has the reflux. Reflux means the spit ups. So the milk which they drank, that will come up, that will irritate their airway and they cough. So parents goes to the doctor gives the different medications and the child will improve. So many times require the medications like to keep the food down, so that the food will go down, the cough will not be there. So when will you go to the doctor if you are coughing, that you have the fever? Fever and cough both together, definitely you have to take the child to the doctor. Second thing, like if the child is feeding less, not able to feed because of the nasal block, because of the throat pain, whatever it may be the reason, child is not feeding well, that is the indication. Urine is started getting lesser and lesser. Child is visibly look the sick, like he looks the ill looking, he is not that active, playful. If you find anything like he is scratching the ear frequently, yes, then this cough might be arising from the ear itself because of the nasal block, ear pain, and he is coughing also. So those are the indication where definitely you have to take to the child to the doctor, so that it will get evaluated, and based on the evaluation medication can be given. So the cough medication, like if you will divide the medication of the cough, that is divided into different groups, because this is a general information lecture, so I cannot inform you those groups and all those things, but there are certain medications which reduces your brain sensitivity to the cough. So basically, if we want to cough, our brain sends signals that now you cough. So there are certain medication which control that center, so that will make that center less responsive, so that the brain don't send the signals to cough. so that your cough is going down. Okay, there are certain medication like the nasal spray. So by the examination, if I will found that child has a severe nasal block, I will advise some nasal spray. There will be some antihistaminics. Histamine is basically the chemical which releases into the body while we have the cough. So we give certain medication that block that chemical release, histamine release. So that is known as antihistaminics. So if the throat is well congested, I will advise some antihistaminic. Sometimes the children cough from the airway. If the airway is swollen, the child coughs. So I will give the medication to reduce that swelling. Many times what happened that the airway is like this big, but it is get into the narrow size or the spasm. Then I will give the medication to make that airway bigger, so that child will not cough. And suppose if it is a bacterial infection like the pneumonia is a bacterial infection. So in the pneumonia, I advise the antibiotic also. Suppose the cough is from the tonsillitis, the bigger tonsils cause a continuous cough. So in that case, I advise the antibiotic to control the tonsillar infection. Okay. So what we have learned today is a cough is a protective reflex. So no need to get much worried if you are coughing. Second thing, cough can be because of the various reasons, starting from the nose to the ear, airway, lungs, everything. You can have the cough. Third thing, there are easier ways to control the cough like the gargling, steam inhalation, honey, those things you can do that will help to reduce the cough. Fourth thing what I have discussed is when to go to the doctor, like if you have the high grade fever with the cough, nasal block, throat pain, ear pain, continuous cough, breathlessness, tired child, sick child, yes, then you have to take the child to the doctor to get assessed that whether he needs any medications or not. Sometimes the cough become bit severe when the lungs and airways are getting involved. So like the asthma, in India it is known as asthma. So asthma also causes the recurrent cough, like the child's airway goes into the spasm frequently and the child will keeps on coughing, which requires the inhalers also. So inhalers are also one type of the medication to control the cough. So there are the various ways we can control the cough. These are the broader guidelines. I don't want to tell you the name of the cough medication because that is not the purpose of our YouTube channel. I am not going to give the treatment on the YouTube channel, but you give the basic information, so the basic guidelines when and how to act. Those kind of the videos we are making. So friends, I hope this cough video must be helpful to you, and I have tried to provide you the useful informations which will help you and which will help your friends, colleagues. You can share this video and you can put the comments if you have any questions, queries, you can put in the comment box. And if you are first time on my YouTube channel, then you can subscribe as well. So I am keeps on preparing this kind of the shorter videos, more informative videos to make children happy, healthy, and to give some information to parents, because many times now there are a lot of informations available, so the parents are more confused that which information is correct. So they just keeps on landing into the doctor's clinic or into the OPD or into the hospital, which is not required many times. Many times I am seeing some parents that you are coming to the hospital too frequently. So you follow certain steps, you wait this till time, if any signs are developing, then you come to the hospital. Because when you go to the clinic or when you go to the hospital, you will sit in the waiting room, and in the waiting room there will be around 8, 10, 15 children. So all the children have some running nose, cough, cold, fever, so they have some infections. So that infection will get transmitted into the waiting room itself. So the clinic and hospitals has more infection because there are all the patients. There are like people are, the healthier people are less, but the sick patients are more. So they transfer the infection from one person to the another. So we want to avoid to go to the clinic, hospitals, so that we don't catch the infection from there. Unlike unfortunate like us, that we have to go to the hospital daily, and we are also keeps on catching some infection from there. But based on our immunity, we are able to fight them well. I hope this video will give you the clear insights how the cough and how the body functions, the amazing body functions. Thank you very much.